when my patients first come in, we always ask, how often do they brush? How often do they floss? Why? Because your oral hygiene is extremely important. It is the port of entry to everything in your body. So if your oral hygiene is not good, you can have a lot of health issues associated with it. People that have diabetes have really bad gum disease, but patients that take care of their gums and have diabetes have a better diabetes control. Whenever you have an issue with your body, it affects the mouth, always affects. I have a lot of patients that are diabetics, and they have to keep their mouth healthy, or else their blood sugars are going to be very out of control. So brushing and flossing is the #1 key. And then on top of that is coming into the dentist regularly. You want to make sure you visit the dentist once every 6 months, not once every year or every 2 years. It's once every 6 months. Patients that have medical conditions, such as, for example, diabetics, they're supposed to get a cleaning once every 3 months to keep their oral hygiene at top shape, so it keeps their diabetes control much better.